USMLE, Step 1. Year 2024, number 1255. Which of the following drugs stimulates the secretion of insulin from intact beta cells in the pancreas? A. Miglitol. B. Alendronate. C. Insulin. D. Metformin. E. Repaglinide. F. Pioglitazone. Repaglinide belongs to a miglitol class used to treat type 2 diabetes. It lowers blood glucose by stimulating the release of insulin from the beta islet cells of the pancreas. It achieves this by binding to and closing in SIR1, ATP-dependent potassium channel, in the beta cell membrane, leading to cell depolarization and a decrease in potassium efflux. This triggers the opening of calcium channels, resulting in the calcium influx and inducing exocytosis of insulin granules. Insulin secretion. It is short-acting, that necessitates dosing prior to each meal. Therefore, hypoglycemia is unlikely to occur and chiefly effective at decreasing postprandial glucose concentrations with less apparent effect on fasting glucose concentrations. Metformin is a biguanide anti-hyperglycemic agent. It exerts an anorexiant effect in most people, decreasing caloric intake. It also exerts its prevailing, glucose-lowering effect by inhibiting hepatic gluconeogenesis and opposing the action of glucagon. It leads to the alteration of the energy metabolism of the cell. It inhibits basal secretion from the pituitary gland of growth hormone, adrenocorticotropic hormone, follicle-stimulating hormone, and expression of proopiomelanocortin, which in part accounts for its insulin-sensitizing effect with multiple actions on tissues including the liver, skeletal muscle, endothelium, adipose tissue, and the ovaries. Miglitol is an inhibitor of alpha-glucosidases used in diabetes mellitus type 2 by preventing the digestion of carbohydrates, such as disaccharides, oligosaccharides, and polysaccharides, into monosaccharides which can be absorbed by the body. It reversibly inhibits the hydrolysis of disaccharides in the intestine. It delays the absorption of carbohydrate from the small intestine and reduces postprandial increases in blood glucose. Pioglitazone is an anti-diabetic medication used to lower blood glucose levels in type 2 diabetes, either alone or in combination with a sulfonylurea, metformin, or insulin. It is in the thiazolidinedione class and works by improving sensitivity of tissues to insulin. Alendronate is a bisphosphonate medication used to treat osteoporosis and Paget's disease of bone. It inhibits osteoclast-mediated bone resorption. The answer is E. Repaglinide.